everyone. My name is Ankur Kumar. Today I am going to present on the topic artificial intelligence, an emerging tool in the diagnosis of Alzheimer disease. These are the content of my slide and the introduction. Alzheimer disease is the most common form of dementia condition in patients, usually characterized by impairment of memory with cognitive loss and loss in intellectual ability. It is the most common form of central nervous system disorder in older people aged less than 65 years, leading to altered brain morphology and finally death. An estimated 50 million people suffer from dementia worldwide, out of which 6 to 70% cases are Alzheimer disease. The present and future of prognostic and diagnostic technique of Alzheimer disease, with special emphasis on the role of AI and multiple targeted in the multimodality imaging of preliminary Alzheimer disease in quantifying their prognosis and diagnosis effectively. Artificial intelligence method used for Alzheimer disease through the use of single biomarker can produce encountering outcomes. They can only identify difference between group. Normal disease treated Zhang et al. Devised a method to combine all three biomarkers for Alzheimer diagnosis, CSF, PET, and MRI, etc., to distinguish between Alzheimer disease and healthy participants. It is found that the multimodal classification technique using CSF, PET, MRI is more reliable, get robust individual mortality for multiple brain regions. Limitations of this therapy: large data size affect reproducibility, accuracy, and robustness, while the small sample size is prone to false results. The majority of studies have used pathological unknown data, which is therefore might lead to the vulgarness result. Furthermore, several studies have not paid much attention to number of common information of attributes. Conclusion: detection of Alzheimer disease at the early stage of difficult using conventional imaging techniques due to the distinguished progression of Alzheimer disease in the patient, whereas early detection and could prevent the progression of disease leading to patient death. Recent extent of evidence suggests that considerable progress has been made in the past decade to characterize the disease in an early stage. The incorporation of artificial intelligence based prognostic models which provide the meaningful insight of Alzheimer disease diagnosis. This will introduce more valuable attribute in clinical investigation to strengthen diagnosis and subsequent treatment in the management of disease progression. Even though it is a promising future in the detection of dementia condition and early stage with AI condition with different rate of progression disease, different stage in the patients. That's all. Thank you so